Now, social isolation has taken a massive toll on our mental health this year. Those in the trans community, people born with one gender but who identify with the other gender, are facing some unique struggles because of the pandemic.
Scripps reporter Chris Conte takes a closer look at how some physicians are trying to make sure no one slips through the cracks.
It has not been an easy year for most of us, but some are struggling more with the isolation of 2020 than others.
There's a lot right now that we're unable to control.
That is Randall Leonard, a staff therapist at Chase Brexton, a healthcare collaborative in Maryland that has staff dedicated to helping those in the trans community.
A lot of my patients have seen that additional anxiety about COVID right now.
Randall doesn't identify with either gender. That's non-binary, and says this gives unique insight into what some of the office's patients are experiencing right now.
There's so many people too that are now, they were practicing going outside and being, especially with trans people, being, themselves and being visible. And now so many of them are just, insulated inside their homes.
We're not as much of a community as we were before.
Dr. Elise Pine is a physician who specializes in trans youth issues. She's seen this school year present its own problems for her patients. Many trans youth are actually more comfortable at home, away from school environments where they might be bullied. But for others, the isolation of virtual learning has been tough.
They're home and they're isolated and can't meet with friends anymore, and it's been very, very difficult in terms of depression and anxiety and just struggling.
Perhaps her biggest concern, though, an increase in patients dealing with severe depression. The CDC says 1 in 4 young adults has struggled with suicidal thoughts since the coronavirus hit.
And having so much isolation is very difficult. There aren't other people who have an eye on you who could say, hey, something's different. You don't look, you don't look the same. You look off. Are you okay? And kind of offering that mental health support.
Her advice to anyone struggling right now, find someone to talk to. If you're a parent with a child who's struggling, make sure they have an outlet where they feel safe.
I'm trying to get people connected however we can.
A critical part of managing the pressure of this pandemic. I'm Chris Conte.